No, I said no. Didn't you hear me, doctor? Eleanor's voice rang through the small consultation room, sharp as a blade slicing the air. She shoved the treatment consent papers back toward Adrian with a decisive flick of her hand, sending the top sheet skidding to the edge of the table. You doctors are always so eager to cut, carve, and pump chemicals into me like I'm some lifeless corpse on a lab table. Adrian looked up, his expression steady, though a dull ache throbbed behind his forehead. He had handled difficult cases before, but rarely had a patient exploded the moment they sat down. The scent of antiseptic still hung in the air, now mingled with the overpowering bergamot and jasmine perfume Eleanor wore, cloying in the closed space, thickening the tension. Mrs. Eleanor. Don't Mrs. Eleanor me, she snapped, her voice climbing higher. I'm healthy, I practice yoga, I eat clean, and I believe in the body's power to heal itself. You people only cared about machines and drugs, never the human being inside. The words struck a nerve in Adrian. He thought of last week, standing helplessly at the bedside of an immigrant patient dying because they couldn't get early treatment. That person had begged for a chance, any chance. And now, sitting before him, was Eleanor, a woman with every privilege the healthcare system could offer, tossing it away like an unwanted trinket. You're healthy? Adrian asked, his voice lower now but still controlled. You have a malignant tumor in your left breast, early stage. That doesn't disappear just because you work out every morning. You're trying to scare me. Eleanor slammed her hand on the table, her blue eyes flashing like a blade of fire. This system profits off patients' fear, and I'm not stupid enough to fall for it. A brief but heavy silence hung between them. The sound of a nurse's keyboard clacking in the hallway slipped through the door, harsh against the taut air. Adrian's hands tightened under the table. He had heard plenty of arguments before, but this one still made his blood run hot. You know, he said, his voice deepening, there are people who wait months just to get an appointment, people who lose their homes and jobs because of treatment costs. But you're here, right now, with every advantage. I just want to make sure you truly understand your decision. Eleanor's gaze hardened. I understand perfectly. I don't need pity or someone telling me how to live. I know what you think about people who believe in natural healing, but this is my body, and it's my right. The air in the room grew cold. Adrian could see every medical argument slipping off the wall of belief she had built. He glanced at the file on the table, the biopsy results plain as day, the MRI scan showing the tumor as a stark, round shadow amid healthy tissue, and he knew time was not on her side. Just an hour earlier, Eleanor had walked in with the poise of someone accustomed to high-end consultation rooms. She had talked about her morning meditations, about her upcoming retreat in Arizona, where desert energy would help her flush out every toxin. Adrian had listened, but in the back of his mind was another thought. If she listened to medicine with even half the passion she gave to energy healing classes, she could have the chance to live many more full years. Now, after Eleanor stormed out of the clinic with her bag in hand and the door slamming behind her, Adrian sank wearily into his chair. Another case where he couldn't break through the wall of denial, but her image would stay with him, like a lingering, unresolved note. The heated exchange with Eleanor had barely ended when the head nurse poked her head in. Dr. Hale, exam room 3, Marcia Williams, biopsy confirms stage 2. She just arrived, seems to be in a hurry. Thanks. He grabbed the chart and walked briskly down the long hallway, the scent of antiseptic mingling with a trace of fresh coffee from the nurse's station. The frustration from the earlier argument still clung to him. He reminded himself to shake it off before stepping into the next room. Every patient was a different story, and often the next story was even more complicated. The door to room 3 opened with a soft click. The woman sitting in the exam chair clutched a worn canvas tote tightly to her side. The faint smell of bleach clung to her light gray uniform, the sharp, acidic scent familiar from budget hotels. Her curly hair was hastily tied back, a few strands falling loose over her ears. Her slip-on shoes were frayed at the heels and marked with traces of cleaning chemicals. Around her wrist was a worn subway pass strap. Without even reading the address in her chart, Adrian could guess. Brooklyn. Probably Flatbush or East New York. Places where people raced bills the way others raced train whistles. Are you Marcia Williams? He asked gently. She looked up, her deep dark eyes carrying the practiced wariness of someone used to hearing bad news. "Yes, doctor." He pulled up a chair, sitting at her level. "I'm Adrian. I've reviewed your results. Your tumor is stage 2. If we treat it early, your chances are very good. I want to hear from you first before we talk about a plan." Marcia swallowed and looked down at her hands. Her thumb rubbed the edge of her tote bag, a small habit to ease anxiety. "I work the morning shift at a hotel, cleaning rooms. If I take time off, I don't get paid. The landlord posted a rent notice just last week. I've got 2 kids. This month we're already short on rent. If I miss too much work, where will they sleep?" The question wasn't defiant like Eleanor's outburst earlier, but it cut deeper than any refusal, a clean slice of reality. Adrian drew in a breath. He closed the chart and met her gaze with warmth. "We won't let you go through this alone. We have a social work department here, financial counselors. There are programs for low-income patients, waived or reduced hospital fees, rental assistance during treatment, food vouchers, transit passes. I can call them in right now." Marcia shook her head slightly, her lips trembling. "How long will that take?" "The paperwork? I get paid in cash, sometimes weeks without a pay stub. My landlord likes cash. I only have rent transfer receipts. English. There are many words I don't understand, and my job, they said if I take more than 3 days off, they'll find someone else. I don't have good insurance. I know this hospital is good, but good is expensive." Adrian heard every word. Cash, receipt, find someone else, like the creak of a rope tightening around a family's neck. He shifted his approach, making it more concrete, more immediate. "We can schedule treatments early in the morning. The infusion room opens at 7. You can do lab work the afternoon before. I'll write to your hotel manager to explain your medical schedule and request flexible shifts. And for the paperwork, we'll sit down and do it together." The trace of doubt in Marcia's eyes thinned slightly, but before it could turn into hope, her phone buzzed violently. The cracked screen lit up with the name Manager Front Desk. She glanced at Adrian for permission, answered, and stepped to the corner. "Hello? Yes, I'm at the hospital. No, I can't make the 2 p.m. room. I told Rosa to swap, sir. Please. I understand." The voice on the other end was sharp enough for Adrian to hear even without speakerphone. She hung up, stifling a sigh. "They said if I missed today's shift too, I shouldn't bother coming in next week." Adrian felt the corner of his mouth twitch, a reflex of frustration he'd long learned to hide. "How long have you worked there?" 5 years. I've never asked for sick leave. This time it's the new manager. He doesn't care about my reasons." "Do you know about the FMLA, Family and Medical Leave Act? It protects your job if you take medical leave." "The hotel I work for is very small. I usually can't meet the required working hours. They say FMLA doesn't apply to me." He nodded, silently calculating, likely true. He swiveled his chair, opened the door, and called softly, "Rena, are you free?" A South Asian woman with a badge reading Rena Patel, social work, appeared, as if she'd been waiting outside. Her voice was gentle yet steady. "Hello, Marcia. May I sit in with you?" Marcia nodded, clutching her tote tighter. Rena spread out a thin stack of papers, set down a pen, and pulled out her iPad. "Let's take this step by step. 1. The hospital's financial aid application. It could significantly reduce costs. 2. A local charity fund that can cover 1 to 3 months of rent during treatment. 3. A temporary Metro card and food vouchers. 4. A letter to your landlord requesting a delay or a payment plan for overdue rent. 5. A flexible treatment schedule, as the doctor mentioned. Could you start by telling me about your monthly income and expenses?" Marcia hesitated, not out of distrust, but from the shame, the bare feeling of having to open her wallet to strangers. Still, she worked closely with Rena, the social worker, to complete the aid applications. Suddenly, a photo slipped from her file. Looking flustered, Marcia introduced her children to the doctor and Rena. Amara, 12, Malik, 15. Amara loves to draw. Malik's crazy about basketball. They fight sometimes, but they know how to wash dishes, cook, and watch each other when I work late. I don't have anyone else here. My mother's in Jamaica. I was planning not to get treatment. I know that sounds stupid here, but if I do, we could lose our home. I can't risk that." In that moment, Adrian heard clearly a kind of refusal of treatment that had nothing to do with superstition and everything to do with a bank account balance. Not, "I don't believe," but "I can't afford it." He leaned forward, clasping his hands. "Marcia, I'll be honest. Treatment will be exhausting. There will be days you're bedridden. There will be days you're well enough to work a few hours. But if you don't treat this, the disease will progress. When that happens, you won't be able to work at all, and the fear of losing your home will come true even faster. We need to make treatment a plan you can live with, not a suffocating burden. I know it's scary, but you have two very strong reasons to fight, and they're waiting for you at home. Before leaving the room, Marcia paused at the door. She turned back, eyes wet but brighter. Doctor, I want to be honest. This morning, I wasn't going to come. I thought, forget it, it's a waste of time. But when Amara slipped a little card into my bag, she'd drawn me wearing a paper crown and wrote, Queen Mama, please stay. I realized I couldn't just disappear. I can't promise I won't be afraid, but I'll come. We'll try. The door closed. Adrian stood still for a long beat. He felt the dense weight in his chest dissolve into a small point of warmth. The shadow of past failures didn't vanish, but in that moment, he held on to another thread, a decision unlocked not by survival charts, but by a paper crown and just enough dinner to get through the day. The day Eleanor returned to the hospital, New York was sunk in a dreary drizzle. Adrian had just stepped into the clinic when he saw her name on the intake list, but this time not under outpatient care. The nurse's note read, bone and lung metastases, admitted for palliative radiation. He stood still for a moment, a knot tightening in his chest. The last time they'd met, she'd shoved the treatment papers off the desk, her voice high and defiant. Now, time had won the battle he had once tried to fight for her. When he stepped into the hospital room, Adrian recognized Eleanor instantly, even though her once thick blonde hair had thinned and her straight shoulders now curved forward. She still wore an expensive silk scarf, but it was tied loosely, revealing the thinness of her neck and the pallor of her skin. She was in the middle of arguing with a young nurse over the consent form. I won't sign until I've read every single word, she said, her voice hoarse but still firm. And I want to know exactly what they're going to do to me, not just a string of long medical terms. Adrian gave the nurse a small nod, signaling that he would take over the conversation. Then he pulled a chair up beside her bed. Eleanor, this is palliative radiation. It's not chemotherapy, not surgery. It will help you breathe easier and relieve the pain in your back and hips. We'll explain it step by step. She looked at him longer than necessary, then let out a breath that was almost weary, not the sharp attack of their last meeting, but a stubbornness still clinging between the cracks. The next day, the hospital placed Eleanor in a shared room. By coincidence, her roommate was Marcia. Adrian knew there might be small clashes. The two women came from different worlds, with very different paths to the hospital. But he also knew that sometimes the strangest connections were tied in the most unlikely places. At first, Eleanor kept her distance. She set her belongings on the bedside table, turned her back toward Marcia, and all but ignored her presence. When Marcia made a video call to help her daughter solve an algebra problem, Eleanor only glanced briefly before returning to the Architectural Digest magazine she had brought. But small moments began to slip in. One afternoon, while Marcia was receiving an IV and instructing her son over the phone on how to boil pasta, Eleanor found herself watching longer. The boy's voice came through the speaker. Is the water boiling yet? I put the noodles in, Mom. And Marcia, tired but smiling, said, Don't forget the salt, son. 2 days later, Amara and Malik visited their mother. Malik pulled a plastic chair into the corner to do his homework, while Amara sat close to the bed, gently squeezing her mother's hand as if afraid to hurt her. From the hallway, Dr. Adrian noticed Eleanor glancing over, her gaze lingering on the sight of the small hand wrapped around the frail one. That night, Marcia had a violent coughing fit. Her water was out of reach. Before the nurse could arrive, Eleanor stepped over, picked up the glass, and handed it to her. Careful, don't choke, she said, her voice raspy. Marcia drank, exhaled, and murmured, Thank you. When the coughing fit subsided, Eleanor stayed by the bed, as if even she was surprised she hadn't gone back to her own. You're so young. How do you endure all this? Marcia looked at her without flinching. I can't die. I'm everything to my kids. If I give up, they lose everything. Of course I'm scared, but the bigger fear is them having to sleep on the street. Eleanor didn't answer right away. A silence settled in, broken only by the steady drip of the IV. That night, when she called her son, she was about to complain about the noisy room, but before she could, his voice cracked. "Mom, we're just scared of losing you. You don't have to believe in machines or medicine, but please, don't leave us." The words cut through something inside Eleanor. She sat in stillness long after hanging up. Her gaze drifted, almost without thinking, to the bed beside hers, where Marcia slept fitfully, her hand still clutching her daughter's handmade card. Adrian stopped by late that night to check on his patients. He saw Eleanor still awake, propped against her pillows, the soft glow of the bedside lamp casting her face in thought. She didn't speak, only gave a small nod when he asked, "You doing okay?" But in that nod he caught the shift, small but real, of a wall he'd once thought unmovable. The next morning, sunlight streamed through the room's large window, warm and gentle, in a way that almost didn't feel like a hospital. Eleanor woke earlier than usual, her hair tousled against the pillow, her silk scarf draped loosely over the chair. She sat quietly on the edge of the bed, turning a nurse's borrowed pen between her fingers. On the table before her lay the consent form she had flatly refused to sign months ago. Marcia was asleep, breathing evenly after a night with less coughing. Eleanor glanced at her new roommate, and for a moment saw the two of them on the same side of a battle. No longer the privileged and the struggling, just two women, each with her own reason to keep going, reasons that mattered equally. When the nurse came in with the supply cart, Eleanor spoke first. "I want to hear the entire radiation process again, and I'll sign." Her voice was low but resolute. Marcia stirred, blinking in slight surprise, then gave a faint smile. That afternoon, the two of them signed their treatment consent forms together, at the same time, at the same table. Marcia laughed. "Dr. Hale probably wouldn't believe this." Eleanor gave a faint chuckle in return, and for the first time, her laughter carried no trace of bitterness. In the days that followed, they became true teammates. Every morning, when the transport cart took them down to the radiation unit, Marcia and Eleanor always sat side by side. They shared everything, from a bite of peanut butter sandwich to stories about their families. Marcia spoke of Jamaica, of a childhood by the sea. Eleanor told of her travels across Europe, of the time she went skiing in Switzerland at 20. Sometimes they teased each other about their chemo season hair and compared whose knit cap was nicer. Whenever Adrian stopped by, he would find the two women, so different in age, race, and class, chatting like old friends. He knew this was something no prescription or treatment plan could ever achieve. Discharge day came sooner than expected. On her way out of the room, Eleanor paused by Marcia's bed and placed a brand new leather-bound notebook in her hands. Inside, the first pages were filled with careful notes, nutrition plans, breathing exercises, tips to ease fatigue after radiation, and some of her favorite quotes. On the inside cover, Eleanor's handwriting read, "You've taught me that we fight not only for ourselves, but for the people we love. I hope this notebook stays with you and your children through the road ahead." Marcia held the notebook to her chest, her eyes brimming. "I'll keep it, as I keep my promise to Amara and Malik, and to you." Eleanor gave a small nod, pressed her lips together, then turned away quickly as if afraid someone might see her moved. Standing at the doorway, Adrian silently witnessed the scene. In that moment, he understood more deeply than ever that a doctor's work is not just prescribing treatments or explaining risks. Denial is a formidable barrier in medicine, but it is not unbreakable. Doctors heal not only with skill, but with patience, empathy, and the ability to help a patient reclaim the courage to face the truth, even when that is harder than any surgery.